Good evening, ladies and gentlemen, and welcome to our inaugural North Texas Medical Society Coalition's Facebook Live event, a conversation with your community physician. In the time of the COVID, that is the COVID-19, we often find ourselves with more questions than answers about what we as citizens should and should not be doing. Our goal tonight is to provide you with some of the answers to these questions facing our community with physicians from our community. My name is Ron Bryant. You're not being able to see me on screen right now, but I'm with you. I'm going to be moderating tonight's session. Joining us tonight, we have doctors Sathya Bhandari, Mark Casanova, John Flores, Gary Floyd, Sejal Mehta, Beth Kasanoff, Shireen Reno, Robert Rogers, and Jonathan Williams. Ladies and gentlemen, welcome to this evening's conversation. So let's get started. My first question is for Dr. Kasanoff. Dr. Kasanoff, let's start off with explaining who's involved with the North Texas Medical Society Coalition.
5 of the county medical societies in North Texas, Collin, Fannin, Dallas, Denton, Grayson, and Tarrant County, have joined together to form this partnership, making it one of the largest physician-led COVID-19 alliances in the United States. We have over 11,000 physician members, and our goal is to collectively advise and inform the members of our North Texas community with scientifically based information.
And for your Facebook audience who may not be familiar with their local county medical society, Dr. Rogers, what are county medical societies and who do they represent?
Well, the Texas Medical Association has 112 county medical societies. Any licensed physician in the state can join the TMA through a county medical society and participate in any of the activities of the organization to fulfill its mission to improve the health of all Texans. Physicians have found that if they work together, supplemented by the staffs of the TMA and the County Medical Society, that they can accomplish much more than any physician could as an individual.
Dr. Flores, your practice is on the border of North Dallas or the Dallas and Denton counties, I believe. So why is it important that these 6 North Texas counties have come together in a coalition to work on public health issues?
You know, Ron, we quickly realized that we're so close together that what affects patients in one county quickly affects patients in the other. You know, if Denton County runs out of ICU beds, those patients are going to end up in Collin County or down in Dallas. And it's very important that we work together to take care of that. You know, also we use our collective leadership to broaden our message and improve our clout.
Now, in early March, our region began to feel the impact of the COVID-19 pandemic, with positive cases rising and civic leaders implementing stay-at-home and physical distancing measures. Dr. Casanova, what is the current status of the COVID-19 pandemic in the North Texas area?
Well, Ron, in the North Texas area, what we've seen is that North Texas is plateauing at a peak. For some of our more urban counties, we peaked towards the beginning of May, end of April. We were hoping to see a decline as we envision a peak as being a hump with an increase and then a decrease. And what we've seen instead is really a very stable, steady state of patient hospitalizations. Now, there's multiple things we look at. We look at positive tests, and we're seeing the number of positive that is affected by the number of individuals that are tested. But what we see in real world, the real activity on the ground level, are the number of individuals who are becoming sick enough, having enough difficulty breathing, that they're entering our hospitals in distress, and a percentage of those are entering our ICUs. What our sister counties are experiencing are now an increase in their numbers as well. So we've seen a peak with plateau in our large counties, an increasing number of cases in our sister counties that lie around our region.
Excellent. Thank you, Doctor. The vast majority of COVID-19 cases have been reported in the large metropolitan areas up until a few weeks ago. But recently, rural counties have begun to get hit with a rapid rise in COVID-19 hospitalizations and ICU admissions. Now, Dr. Williams, as a physician in remote Grayson County, why are the rural counties particularly vulnerable to any spike that impacts their hospitals?
Well, when we're looking at this, basically, rural counties in general are vulnerable because they have fewer resources, more limited infrastructure, and it's spread over a much larger area. And so what we're seeing is basically our spike or our peak is actually coming now about a month or more after it's been in larger metropolitan areas. And logically speaking, it's simply spreading out from the core metropolitan out into the surrounding rural communities. But where we're at, you have many counties that may have no hospital, or if they do have a small hospital, no ICU beds, or potentially no pulmonologist or ventilators. And so what we're looking at is that we're a team with nobody on the bench. So when we get a spike in a rural community, we've only got what we've got. And when that capacity is absorbed or overwhelmed or overutilized, all we can do is divert, which means the citizens in rural communities have a geographic isolation or barrier from the definitive care that they may require if they become critical. Looking at transport and having to move them down the pike or down into a larger area can fractionate their care, fragment it, and delay it.
Very interesting. Thank you, sir. We know from hospitalization and ICU data that stay-at-home and physical distancing measures were very critical for flattening the curve, and we know we needed to do that. We were fortunate that North Texas never experienced a healthcare surge, and that we in the cities like New York and Seattle. So Dr. Reno, why is it important that people continue to be careful as they begin to resume their regular activities? Tell us why.
Some of the things that we have to think about is we did have the advantage of seeing what happened in those larger cities. And even though here in Dallas and in Texas, we have a population that is less densely collected, we still have to worry about, the virus. It's so new, we don't know exactly how it's going to act. Like a flu virus may just be active during certain seasons. We don't know the status of what COVID-19 is going to do. So I've encouraged all of my patients and my family members and things like that to continue, social distancing, stay at home when you're sick, do frequent hand washing, and then also just basically doing all the things that we've been told to do, washing the surfaces and things like that. Make sure that the places that you choose to frequent do that as well. And as you go out and go to restaurants and things like that, make sure that they are following the guidelines as well. With that, we can keep our numbers low.
Wonderful. A little bit of housekeeping real quick. If you have questions or if you need more information, please visit the North Texas Medical Society Coalition online, and you can log on to northtexasmsc.org. That's northtexasmsc.org. So Dr. Casanova, speaking of public gatherings, graduation season is upon us, and some schools are conducting ceremonies in large stadiums and the Texas Motor Speedway. I saw that, on a news report just recently. If someone wants to attend a ceremony, what are the 3 most important things that they should do to keep as safe as possible in these situations?
Well, I think that's a great question. And the first thing that we all should do, whether we're going to a graduation of the Motor Speedway or even to our local favorite restaurant that's reopened at 50% capacity, is before you walk out the door, you need to ask yourself a simple question. Do I fall into a high-risk category? Am I a high-risk individual? Do I have an impaired immune system? Do I have lung problems, heart problems, diabetes? Am I being currently treated for cancer? Do I have issues that would put myself at particular risk for contracting, having very serious complications from it? Question number 2 might be, okay, I don't fall into that category, but maybe my elderly father lives with us. Maybe Nana lives with us. We've got to keep in mind her health, his health, and possibly bringing COVID into the home. So I think those are the first questions before the individual even leaves the door. Next thing they ask themselves is the location I'm going to, as my colleague Dr. Reno mentioned, are they practicing safe measures? And can I practice the safe measures I need to when I'm in that environment? Can I have the ability, do I have the ability to stay 6 feet physically distanced from another individual? Do I have my own hand sanitizer I can keep with me? Am I wearing a face mask? And preferably, is there either great ventilation or is this an open air outdoor venue? If the answer is yes and favorable to those questions, and I myself am not a high risk individual and I'm not caring for a high risk individual, then with maintaining all those safe practices that Dr. Reno spoke of and that protected us on the front end of this in North Texas, one can embark. We're confident that North Texas can continue to get this right.
Excellent. We're going back to Dr. Floyd. Now, in addition to graduations, other summer school and summer social activities are ramping up and people will be gathering more frequently. We know that's going to happen. This will likely lead to a rise in COVID-19 cases. We hope that will not happen. But what should someone do if they think that they may have put themselves in a situation where they were exposed to the COVID-19 virus?
Thank you, Ron. And certainly the larger gatherings can increase your exposure to COVID. If you feel like you've been exposed, call your physician to discuss your situation with them. If you don't have a physician, you can call the public health department. They can help you determine if you need to be tested. We don't recommend going into an emergency room unless you have significant respiratory distress, breathing difficulty, other problems that might occur or might need emergent treatment. And then if you really think you've been exposed, isolate yourself. 14 days, stay away from loved ones, from friends and family. You don't want to give it to them. If while you're isolated, you develop symptoms, you need to stay isolated for 10 days after all symptoms resolve. And during all that time, you want to maintain physical distancing, 6 feet from others. You want to wear a face mask. We know that this virus sheds 2 to 3 days before any symptoms develop and up to 10 days after all symptoms resolved. And also keep washing your hands.
Excellent. Dr. Rogers, we're coming back to you. A lot of people have expressed nervousness about going to physicians for preventative visits, or if they have a new health symptom due to fear about possible exposure to COVID-19. But we also know that early detection and visiting your doctor with early signs of any health concern is important. So what can you tell our viewers about how doctors' offices are prepared to see their patients safely?
Well, thanks, Ron. That's a great question. And I think it's been a paradoxical situation here in the middle of a pandemic that many doctors' offices have been almost empty because of these fears. But physicians and their staffs really do understand how to see their patients as safely as possible. The Texas Medical Board provided guidelines for safe practice for our offices. These include that both the patient and the physician or staff member should wear a face covering if they're within 6 feet of each other, which of course is a great idea in the general population as well. We also are screening patients for coronavirus risk factors. Most of us are taking temperatures of the patients before they even enter the office. And that we're also going to use what you've heard of as the N95 masks. We now finally have more of those available. We wear N95s and face shields if we're doing any procedure that creates aerosols. Our offices have also really worked hard to encourage good distancing in the waiting rooms. In our office, we've taken many of the chairs out of our waiting room. We also ask people to call when they get here and to stay in their car, and then we can call them to come in for their visit so they can go directly to an exam room. Many of us are also offering visits by telemedicine where people can stay in their own homes. I've been doing many of my visits recently with telemedicine, and it's been great. I'm an allergist. I have lots of patients with asthma, and we can do a good quality checkup on how people are doing through telemedicine. So the most important message I can give to anybody is that you need to be attentive to your own health, whether or not there's a pandemic. Keeping your chronic medical conditions under control is more important now than ever.
We're speaking with the North Texas Medical Society Coalition. We just have a couple more questions left. So we're going to go back to Dr. Bandari. Speaking of provocative measures to keep safe, what would the medical community advise schools as they look to possibly resume classes this fall?
That's a great question, and it's on, I think, everybody's mind, especially my mind, because I'm a parent. One of the things that is, one feature that is similar in all of these highly infectious areas is the fact that they are all densely populated. And so it's no wonder that we're all concerned about our kids going back to school, because inherently these schools are densely populated. So I really want to bring up an example of how we were able to train young recruits successfully around this coronavirus situation. And back in March and April, about 10,000 plus recruits came into the Air Force Base in San Antonio, right here in Texas. And they had a 7-week training session. And during that training session, all of these young recruits ate together, they trained together, they had a lot of exposure to each other. Out of all those 10,000 people plus, actually 10,000 plus, only 5 of those recruits ended up becoming COVID-19 positive. 5 out of 10,000 plus is actually a pretty great number. And out of those 5, actually 3 of those people actually knew each other. So that's how they became infected. How did they do this? Well, they did it basically by looking at science. So everybody wore a mask. All the recruits were tested every day on fevers, whether they had any symptoms. If they had any symptoms, they were taken to the sick bay and evaluated immediately. The other thing that happened a lot was testing. So they tested everybody, and they tested frequently. And if someone was positive, they ended up quarantining them. So this was a great way of identifying high-risk people who could possibly spread the disease and quarantine them so they did not affect other people. So what happened after all the training was that people got trained. The sick were quarantined, and they probably got training on their own as well, and it was a success. So as a coalition, we'd like for our schools really to look at examples like this. During our summer break, we have all around the world schools that are actually in session, and they're actually performing all of these measures in order to keep their children safe. If we can keep our children safe, and we can keep our children in school, and we can also keep our teachers safe, then we can keep our whole entire community safe. And I know I want my kids to go back to school in the fall, and as we all do. So I think this is the reason why we're around. We're here to help in that way.
That is so wonderful. We're winding down to our final question, and this has got to do with face masks. There are a lot of confusion in the public about wearing their face masks or coverings. So for my last question to Dr. Mehta, I know you see a lot of people not wearing face masks or wearing them improperly. I know I see them when I go out in public. So can you share with our viewers why face masks are so recommended and important at this particular time moving forward?
Absolutely, Ron. And let me just sum up what we talked about. The most important CDC guidelines at this point are stay at home as much as possible and practice social distancing when we are outside, at least 6 feet away from each other, and clean our hands often with soap and water or hand sanitizer. CDC also is recommending that everyone wear cloth face covering. And it's not just mask, it's cloth face covering. That's the current recommendation when we leave our home. Why it is important? Because we know that whether we are infected, if we are infected, we may or may not know, because testing is not readily available to everyone just yet. And a person can spread disease whether they are symptomatic or not. So they may feel just fine that, okay, there is nothing wrong with me. I'm doing great. I'm not running fever, but they still might be contagious. So wearing facial covering, cloth covering, or mask is actually community service, if you look at it, we are trying to keep other people safe and healthy by protecting our face, nose, and mouth, because droplets can go far, especially when talking or sneezing or coughing, and we are preventing them by cloth face covering. Now, if we are wearing cloth face covering, it needs to be washed on a daily basis in a washing machine or with a bleach. It should be dried completely before the use again. And if there is a mask, it can be discarded based on whatever type of mask we are wearing, and recommendation is there. We gotta make sure that mouth and nose is fully covered, and covering fits snugly around the side of the face so that there is no gap. And there should not be any difficulty breathing while we have the cloth face covering. And cloth face covering can be tied or otherwise be secured to prevent sleeping. Important thing to note, please do not put the face covering or the mask on kids age 2 or younger. They do not understand there is a possibility that they could have experienced difficulty breathing. So very young kids, we should not do that. Again, also other people who are debilitated or unable to remove their mask in case of experiencing breathing trouble, then they should not be masked or have a cloth face covering. But with that, the most important thing, the simple thing, common sense thing to do is to cover our face, our nose and mouth when we are out in public, when we leave the home. More habit we create for that, better we'll be serving our community.
Namaste. This is so wonderful. This is great information. Doctors, are you ready? Please demonstrate the proper method of putting a mask on and taking it off before we leave, and we can show everybody this lesson for this evening. Masks, please.
Okay.
Dr. Floyd, you got to say something.
It's the very in look, if you haven't noticed, out and about. So we are all now fashionable, and
We
Well,
all look very fashionable, and I think a whole new industry is gonna come up with the mask matching our outfits. I'm ready for that.
I wish the viewers could see me right now. I wish the viewers could see me right now because I have a very fashionable mask myself. But next time, we'll save that for next time. Doctors, do you have any closing comments? Anyone can chime in if you have any closing comments as we prepare to depart.
I want to build off my colleague, Dr. Mehta's statement that all of our endeavors that we're embarking upon at this time is a way for every one of us as individuals to be care providers. Okay. We're facing a condition, an infectious disease for which we have, as of yet, no effective treatment and no effective vaccine. And I want to commend the citizens of North Texas, business leaders, you, Ron, and the others in the media who are assisting us in empowering every individual to become a care provider, to become a public health activist, and to simply share in innate love of each other and protection of each other. It's really that simple, and it can be that simple of a solution for us to get out of this.
And you know, Ron, we are in the North Texas area, all of us. We are available. We'd be happy to assist or discuss preparations with schools, churches, what have you. So we're available, and we're willing to advise or to answer questions as they come up.
Anyone else?
North Texas area, so that's what we serve.
In good old country lingo, I just tell you that the best resource for overcoming COVID is between your ears. So use it.
Excellent. Excellent. We want to thank you all for tuning in. We want to thank you all for sharing this opportunity. And for additional information, again, And if you have questions, please visit the North Texas Medical Society Coalition online. That's online. Just log in and punch up northtexasmsc.org. That's northtexasmsc.org. My name's Ron Bryant. It's been a pleasure being with you. We want to thank all of our doctors again. And I also want to thank Ms. Lowry for this opportunity on this evening. As we sign off, thank you and goodbye. And everyone stay safe and stay blessed.
Night all.
Sure.
Good night.